Hello, welcome to the live stream. Let me know if this worked because guess what? Uh the countdown was running and it was on air on my stream deck, but it was not on air on YouTube. So anyway, I've just been sitting here being like, "Man, the chat's really quiet." Okay. Nobody's commenting before things start, and that's um because I wasn't live. What a fun fact. But here's the thing I'll say is that the cat cam is broken. So the cat cam that we've been using for a long time, it I think the cord got well, it's very clear the cord has been wrangled with, but now it won't stay on. Aaron thought that he could switch it in 2 minutes before the stream. That proved incorrect. Anyway, so you've missed nothing, David. I wasn't even live until like 30 seconds ago. But hello, welcome. We have so much to cover today. And I guess the good news is, except for anybody who values their evening after this live stream, is that I don't have a meeting after this. So you know what? We can sit here and we can talk about this massive omnibus tax and spending bill that the Republicans passed last week and how it is going to affect people. Obviously, this is primarily focused on Americans and US residents, but there's some things happening right now that might end up affecting Canadians, I would say. Obviously, like we've talked a lot about tariffs. The tariffs were not actually part of the bill that just went through Congress. And the reason it's not part of the bill is because Donald Trump prefers to do all economic activities via, not via Congress, but via executive action. So because of that, the tariffs do have quite a lot of effect on other countries in the world, especially like key trading partners, other rich countries, countries that have significant amounts of debt that is denominated in US dollars. Like tariffs affect all of these things. But most of this is going to affect Americans. And there's a lot. There's so much to unpack. Like we cannot possibly get at all of it. I think there's a couple things. What should you know as top line effects? So, for a lot of people, you might not see the immediate effects if you are not using Medicaid right now, which might have a different name in your state. So, not everybody realizes that when they're on Kentucky Cares or Oregon Health Plan or Apple Health in Washington, like some people do not realize that is Medicaid. But if you are on Medicaid, your access to healthcare will be significantly impacted starting at the end of next year. So you may not qualify for it anymore, or you are going to have to go through some level of bureaucracy to do both documentation about work activities, taking care of family members if you're like exempted in some way, disability, and your income. And at a higher rate than a lot of people do for Medicaid eligibility now. However, even if you are not someone who relies on Medicaid as your primary health care, if you access the ACA marketplaces in your state, if you receive subsidies to get marketplace coverage, you will start to see effects pretty quickly. If you are in a high tax state, so Oregon is a great example. We don't have sales tax here, and because of that, and we limit property tax with measures that we implemented in the 1990s. And because of that, we have a pretty high income tax burden at the state level. If you are from a state where properties are expensive and you own a home, so you pay a lot in property tax, or you're from a state with a high income tax, you may see your federal tax bill reduced even more than it was under the Tax Cut and Job Acts, which was the 2017 Trump tax bill. a lot of people were kind of freaking out about these implementations. These were still mostly in effect right now. There was a couple of them were kind of like undone or overwritten by either like COVID era stuff or by Biden era stuff, like the Inflation Reduction Act. But there is essentially the Trump Tax Cut and Job Act from 2017, which was temporary and was going to sunset, has been re-upped, and then it's been beefed up in certain sections. So there's parts of it that are like really extensively increased. So the state and local tax deduction, in order to deduct from your federal taxes, your state and local taxes, you used to kind of do that only if you were over the threshold to itemize. It became even less true for a lot of people after the Trump tax bill because they doubled the standard deduction. So the standard deduction increased by 2 for every category of type of household. And because of that, even fewer people itemized. And this is a thing that, like, as someone who used to work in nonprofit development, a lot more people think that they itemize than actually do and sit down and do it. There is a belief that just because you file taxes in the US, because they're so confusing, a lot of people think that's itemizing. But itemizing is an extra layer above that. If you're just using TurboTax or an online tax prep tool, as most people do to file their American taxes, you may not even be aware of whether or not you're taking the standard or the itemized deduction because they will just run the numbers for you, right? So any of those tax prep tools will decide that. I know you all are probably like a lot more locked in and aware of what is happening on your taxes than I would just say the average American. Having helped at least 100 people file their taxes in my life, let's say 100 people, I think it's more than that, but let's say 100, I can tell you very confidently most people are not able to articulate if they are itemizing or taking the standard deduction. So anyway, a lot fewer people after the standard deduction was doubled even decided to take their state and local tax deduction, because if you earn like a regular median income and you don't own a house, and you don't pay a lot in property taxes, there was almost no situation in which you were going to want to itemize because the standard deduction became so large. Now, the standard deduction has stayed steady from the 2017 Tax Cut and Job Act, but now we've got this pump up of the limit of how much state and local taxes you can. So in 2017, it was limited to $10,000, which does sound bananas because that's a lot of state tax to pay for most people. In Oregon, for example, like our top tax rate is, I believe right now, 9.4% for income taxes. Let me double check that. Actually, let me get it right. It's 9.9 now. Okay, so our top tax rate is 9.9% for the highest like income earners. So that's functionally 10%. A person that doesn't own a home, that let's say doesn't have like high medical expenses, because that's another thing that you might itemize, but it has to be over 8.4% of your like total income. So someone who's just, in a decently well-paying job and makes $100,000 and doesn't own a home and doesn't have high medical expenses, they would be and it is a single person household for the purposes of this example, they would essentially only once you make $100,000 be in the category of starting to look at it being more functional for them to take the state and local itemize and take the SALT deduction. SALT is what people call it, state and local tax. But now the people that were really upset about these limits being put into place in 2017 were people in high state income tax states with high property taxes. And so let's just think about what those are. Those tend to be coastal, they tend to be cities. And because of that, they tend to be more liberal because you've got the tax and spend liberals, right? Because of that, it was kind of seen as like, oh, is this trust trying to punish liberal states, right? They've now quadrupled that state and local tax deduction. So the SALT deduction is now up to $40,000. So for people that own a home that have ever increasing property taxes as values have gone bananas in the past couple years, like overall home values, especially in cities, have gone up substantially since 2017. So there are a lot of people for which this could represent a pretty significant savings on their taxes. When the numbers are broken down, so the Congressional Budget Office is who like does kind of all of the basic calculations around like what bills are going to cost, if they're going to increase the deficit, what kind of impacts that they're going to have on them. The CBO has all of their numbers essentially say the people that are going to see the most benefits from this tax bill are higher income earners. But here's the thing. The core constituency of the president is not the highest income earners. They do exist, obviously, in his constituency, but the people that got him elected are working and middle class people who mostly do not live in liberal coastal cities. So are they going to see benefits from the extension of these 2017 Jobs Acts? Or tax bill? Yes. There's a couple things they're going to see. One, the child tax credit has been bumped up a little more even. So it's gone from $2,000 to $2,200. The child tax credit can be a huge boon for working families. And for a lot of people, it will wipe out their entire federal tax liability and also contribute to a lot of different people getting refunds if you are in kind of lower and middle class income families. If you are in a lower income household and you have multiple children, but you're also a working adult, but in a lower income tax bracket, you could make a lot of money back on your taxes as transfers, meaning you get more back than you put into the system overall if you get the earned income tax credit and the child tax credit. Like that alone can make a huge difference, right? And if you have multiple children, those child tax credits stack. So that can help. An extra $400 can make a lot of difference to people at tax time, right? Okay, who else is going to benefit? This is the really novel thing because most of the stuff in this bill with regards to taxes is not new and novel. It's the very weird tax bill from 2017. And I say weird because they did a lot of stuff that was like not considered typical tax policy in that. But that tax bill, we've all gotten used to it. Most of us have filed taxes over and over from it. Sorry, I've inhaled dust. You all talk amongst yourselves while I work myself out here. I don't know what dust I just inhaled. Okay, so K-Walk Comedy, who is giving us a weekly update on how many days left. Happy Tuesday, or is it, with the financial news ahead? My 320 days are seeming further and further away. No, I believe in you. You're going to make it to the end, and we're all going to enjoy seeing how you spend your time in retirement and living vicariously through you. Is it cat hair? I don't know if it's cat hair. I don't even have like a powdered dust. I got a cinnamon roll today because it's my birthday week, which is why I'm also like, even for me, a little ridiculously dressed up today. I decided to wear the floofy dress because it's my birthday week. My birthday was yesterday. But I got a cinnamon roll again, which I think is the third time I've gotten a cinnamon roll instead of a new and novel flavor. But they only had the savory flavors or the chocolate flavors left. And I just, honestly, I did not want to eat a donut chicken parmesan sandwich this week. Vegan chicken parmesan sandwich. I was like not up for it. KWAC Comedy says I'm on FMLA right now, but with this kind of admin, I don't know if that thing will be part of the future. Oh, are you on FMLA over the summer? I hope everything's okay. Usually FMLA is, I'm glad we have it, but usually it's not great news. It costs them nothing, so I would say that it would continue to exist just because it doesn't cost the government any money. They're trying to get rid of things that cost them money, but then spend money on other things. Okay, so back to now that I've recovered my voice again. Let's talk about the things that people will see an impact that are going to feel distinctly like a change. So, like I said, this Tax Cut and Job Act happened in 2017. Because of that, like, we've been doing taxes mainly in this environment, aside for some weird stuff that happened with COVID in 2020, 2021 tax seasons. And a tiny bit of it was still left over in 2022. There were all these kind of like temporary things that happened with taxes that were specific to COVID relief. But otherwise, we've been operating in this environment for quite a few years now. So most of us are like, all right, whatever. We filed 7 different tax seasons of this. So we're used to it at this point. We are used to the doubled standard deduction. We're used to, the way SALT got limited. All of these sorts of things is like, all of these sorts of things are quite usual to us now. But there's some two very interesting things happening here. So there are things that the core constituents and non-super duper rich people, because the 2017 tax bill was like really benefited rich people. It includes a tax break for overtime and tips. So workers can deduct up to $25,000 in tips from their taxes as long as they customarily and regularly receive tips. So this is going to be servers, parking attendants, DoorDash people, any of this category of tipped workers. And there is a distinct definition of tipped workers in the law, but it can vary from state to state. Sometimes it's based on how many tips you might get per month. Like if you receive, for a long time, it was like if you received at least $80 of tips a month on average, you were considered a tipped employee. So that's if you customarily and regularly receive them. Massage therapists are a great example of like someone who would customarily and regularly receive them. You will be able to deduct up to $25,000 in tips. One very niche thing that I could see, a lot of exotic dancers do not file taxes, and that's because they receive almost all their income in tips. But we did see that this would end up becoming like a problem for a lot of dancers when they wanted to apply for OHP Medicaid. Once there was Medicaid expansion, they wanted to get health insurance and they didn't have an ability to track their income, or they wanted to do something like buy a house. And sometimes they would end up in this category of like, the IRS would come knocking when dancers would buy a house in cash, and then they would be like, where did all that cash come from? Or some dancers would maintain like another job that they would, would like use as sort of their W-2 income, and then they wouldn't track any of their income from dancing. Not all clubs are run this way, but the vast majority of strip clubs, everybody there is a like a 1099 worker, but you might not ever get a 1099. You are considered an independent contractor. You usually pay the club to work there, so you'll pay a stage fee, which in really expensive cities and high-end clubs could be hundreds of dollars a night. But in places with a lot of competition, like Portland has tons of strip clubs, so there's a lot of competition. And if a club had too high of a stage fee, the dancers would just move to a different club. It's kind of beautiful microeconomics right there. So the stage fees here tend to be in like the $5 to $20 a night range. They can be higher depending on like the night and the shift. And then you'll tip out the other workers who work there. And tip them out. This is standard practice in pretty much any hospitality industry. Usually, front of the house people will tip out back of the house people. Sometimes it'll be done in a tip pool. For dancers, there will never be a tip pool because they are very much influencing their own earnings there. And because of that, they would just pay kind of a standard flat rate to the employees that help facilitate their job. So usually it would be like security, DJ, and bartender. Sometimes like real back of the house employees, if there's like a dishwasher and stuff like that. In Oregon, we're kind of unique in that a lot of strip clubs will serve quite elaborate food, and that's because we have very strict like liquor laws in places that serve full liquor, but we're also unique in that we have full nude strip clubs that also have can have full liquor, because in a lot of places, maybe if there is full alcohol and not just beer and wine, then they can be topless only, or maybe not even like full like topless. They, have to wear pasty, like little pasty kind of things over the top. So there's all sorts of like, the sin laws vary, like not just from state to state, but city to city. But when I saw this $25,000 of being able to deduct this in tips, this is really interesting because this is going to put highly tipped employees that are like tattoo artists are also like another category of highly tipped employees, where a huge chunk of their like overall wages and being independent contractors comes in as tips. You could end up seeing them being in the position of suddenly wanting to start being W-2 employees so that those tips could be taxed. I have been trying to look through this, and I still cannot figure out if someone is filing a Schedule C. So if they're an independent contractor, like a dancer or a DoorDash delivery worker, I can't figure out if tips is going to be able to be declared on a Schedule C, because normally if you are an independent business and you're filing your own, business tax return along with your personal income, like tips is not a line. It's just how much money came in. And for a lot of those, DoorDash is a great example where you are obviously going to get a 1099 from the company, and it's going to come to you and it will declare tips because almost everybody is not tipping in cash. They are tipping in the app. So that's a category of people that could be like greatly benefit from this. Are people that are like fully, cash operating employees where like strippers going to benefit from this? I don't know, but I could see a move towards asking for dancers to be W-2 employees just so that they could take advantage of this tax deduction. Rural asked the question that I was just answering. I was digging through this and it is unclear to me. And I think it's very possible. This often happens when these like huge bills are built in around taxes, is we don't really know until the IRS makes a ruling on how the bill will affect and show up, right? So what Congress decides is like only one part of the tax code, right? So like they decide something and then the IRS has to figure out how to interpret that and then built it in, and then they have to figure out enforcement. And so I spent quite a lot of time looking through the like language and I can't figure it out yet. And I haven't found anybody who is confidently saying that they do understand it. So, Oh, K-Walk comedy. I'm so sorry. Caring for my parents' mom with heart failure went to hospital with pneumonia. Tested positive for COVID. Dad has COVID too so far. I'm the negative caregiver for both. Well, stay safe and stay negative. I don't know what to tell you to do that other than maybe mask, but um wow, that is very hard. I'm glad you do have access to FMLA though. David says, who thinks someone is going to restructure their work to become a tipped worker? I mean, I could absolutely see that. However, most states have a tipped minimum wage. And if you're like a fully tipped worker, so let's say you earn an hourly wage of the federal minimum wage. So if you're getting the federal minimum wage of 7.25 per hour and you're like, hey, I earn less than $25,000 a year, what if I switch to becoming a tipped employee? I could see that being valuable. Like I could see someone being like, yeah, okay, my new minimum wage is going to be 2.16 an hour, which is the federal tip minimum wage. Which effectively means you get like a $0 paycheck because that all just goes to like Social Security, or 2.13 an hour. So like I could see someone trying to do a galaxy brain move and doing that in order to take advantage. There is another category of workers, of which many of which are not super rich people, that could very well benefit from this. So there's the tipped workers side of it. And this is for this tax year. So you don't even have to wait. Like a lot of these other provisions are going to take quite a long time to catch up, like all the Medicaid stuff. It doesn't go into effect until the end of 2026, although I believe states can choose to implement it earlier, but they have to comply by the end of 2026. But all the tax stuff is like retroactive to the beginning of this tax year. So because we file for this tax year in April of next year, unless there's the pandemic, in which case we file months later. So I could see that. Now, here's what the other provision that's very, very interesting and might apply to many of you, which is now overtime is not taxed, up to $12,500. So that is similar to the tip law. These are both temporary laws. So they take place starting January 1, 2025, but they end right at the end of 2028 after Trump will be leaving office. So it's this 3-year kind of experiment in taxes. Deducting the $12,500 in overtime pay is really fascinating to me because just like the tipped worker and the non-tipped worker, there is a lot of kind of bureaucratic definitions that come into play here. So for people that work for large employers or people that are represented by a collective bargaining agreement, usually whether or not you're exempt or non-exempt, meaning eligible for overtime and not eligible for overtime, is pretty clearly defined. It's also defined in federal law as far as like, you are not allowed to say that someone is an exempt employee, not eligible for overtime, if they do not meet a multi-part test set out. So they have to be using a certain amount of discretion in their job or managing people. They also need to earn over a threshold. That threshold was going to go up under Biden, but it was originally going to go up under Obama, but then it got brought back down and it's fairly low. It's like 40, what is it now? Okay. Exempt test threshold. I want to state it correctly. States can have a higher threshold, but okay. So it's the current threshold is 35,568. It was raised to 43,888 per year. So essentially that means if you are an employer and you are paying someone less than $35,568 per year, you cannot say they are not eligible for overtime no matter what their job duties are. Additionally, even if they make more than that amount, but they fundamentally are not an exempt employee, they are not like managing people, or not making decisions on a certain scale, then they have to be executive, administrative, or professional employees. Like there is like an actual category under BOLI about DOL. BOLI is Oregon. But there is an actual category of what you have to do. So one thing I'm very interested in here is, are we going to see smaller employers for which their employees are not collectively bargaining? Are we going to see them in this like category of trying to make employees more likely to be classified as exempt so they don't qualify for overtime? Or are employers going to say, well, even if we pay you more in overtime because they're exempt from income tax now, that's actually like even better for you. And they're going to use it to like make overtime mandatory, but kind of sell it as a benefit. It's unclear to me if employers are going to kind of react to that. Rural says there's no way we're going to have all this tax stuff figured out by filing season. Here's what I have to say is that every year they say that and the IRS does it. But that's pre-Doge, because they did already like cut a bunch of IRS jobs, but Biden had like finally in the Inflation Reduction Act, Congress had gotten a bunch more money for the IRS to be able to like properly staff, because this is very chaotic for the IRS to figure out. And this is what has been happening for the past couple years, because all of that like COVID release stuff, a ton of that burden was put on the IRS. We also administer healthcare in this country, at least partially now, via the IRS, which is not the easiest thing for the IRS to do on top of everything. We do so much stuff via our tax system in the US. I will say the IRS has had this happen before. Will we have a case back and forth about whether or not this, will we have an IRS case about a lot of these things? I think it's very likely that we're going to shake them out. Okay. I think we've walked through most of the tax stuff. I don't know if anybody else has any other tax questions. I think the really big important thing to like wrap your head around with the taxes that is different is that like, one, the people that are going to benefit from most of the extension of the Tax Cut and Jobs Act, that is hard for me to say every time. People who are going to benefit the most are the richest people, right? There's several like kind of categories of things in there that only benefit high income people, SALT being one of them. However, the overtime and the tips are something to watch. And I think it's going to be interesting to see how this shakes out. The child tax credit increase is like an extra $200, $400, $600, depending on how many kids you have. Great. This is not the phenomenal, amazing, temporary, like enhanced child tax credit that we saw, during peak COVID eras. This is not the kind of like greatly increased benefits that we saw during the last administration aimed at families that were all fairly temporary. But this could really help some people and some lower income earners take home a little bit more. The big thing is for a lot of people that are lower and middle income, they actually already get back a lot in federal taxes, and a lot of these things are not refundable. These are just deductions. So if you already had a negative tax rate, which is true for a lot of lower income working class people in the United States, you essentially, between EITC, child tax credit, all of that, you are getting back money as opposed to putting money in. This doesn't apply to Social Security and Medicare, which you kind of pay regardless. But the people who who pay a lot in taxes and therefore can benefit a lot from non-refundable credits or from being able to deduct things are the highest income folks. So, all right. Now we've talked about that tax bill. Benefits rich people, but there's some kind of interesting things that it'll be fascinating to watch them shake out. No idea how the IRS is going to do it with their greatly reduced staff in the era of Doge. Now, the next and the most important thing, and probably a thing you've heard a lot about, like I said, this bill is massive. A lot of the people that voted for it had no idea what is in it because there's so many weird things in it. So we cannot talk about like everything, but the biggest and most important things are healthcare. And it isn't a healthcare bill, but it is a healthcare bill because Congress cut nearly $1 trillion from Medicaid. And so this is $1 trillion cut. It's over 10 years. So it's not $1 trillion tomorrow. The other thing that they did is they made enrollment in that program and in the Marketplace Affordable Care Act plans that a lot of people have been using since the Obama years to get their health insurance needs. So, the first ACA plans came out in 2014 and that were accessible to people for all intents and purposes. Healthcare is complicated, but Medicaid has now implemented something that has been tried in a couple states and existed prior to the ACA. They are now going to have to re-implement this in states. So their work requirements, and the work requirements are not overly burdensome. They're for able-bodied childless adults. So people that don't have minor children that they're caring for, people that are not disabled, people that are not considered elderly and not children that are receiving Medicaid. The whole idea is that now they will have to be engaged in looking for work, working, volunteer activities. There's a whole bunch of things that make the list. A lot of states require this for SNAP benefits now. And so, it's not overly burdensome. It's 80 hours per month. So essentially, it would be equivalent to 20 hours of XYZ. The problem is that this, if you look at surveys of Americans, most Americans support the idea of, if someone is receiving Medicaid, they should be doing something productive. Realistically, they think, oh, yes, work requirements are great. The problem is, the work requirements, there's been two prominent states where they've tried to implement these Medicaid work requirements, Georgia and Arkansas, and they did not result in people working more. They resulted in a lot of people losing their health insurance, and they cost tons more. In Georgia, particularly, they launched it in July 2023. It cost them $90 million to implement this work requirement, and only $26 million of that was actually spent on healthcare. And that is because the checking, the dealing with the bureaucracy, the checking up on people about whether or not they have, if you've ever gotten unemployment and you've had to go through the phone tree of, oh, yes, I engaged in work, I filled in applications, you had to do all that. You know what a pain in the butt it is for unemployment. Now imagine that you are having to do that on a regular basis in order to keep your health insurance, and you're maybe a low-income person that is in the same camp of, you are caring for a child, you are also working a job. people that are losing their healthcare usually under these Medicaid work requirements are not people that aren't working. They are people that are either working or doing any of these other kind of quote unquote productive, I hate this term, but productive activities like caring for a minor child, or they are disabled and unable to work, that just cannot handle the burden of the bureaucracy because the bureaucracy is not set up for the level of information they're trying to collect. In a lot of places for Medicaid, you only need to prove your income like once a year, right? In some places, you need to prove it like every month. In most places, they say like, if your income stays the same, then we need an annual certification. Some places have even moved that to like 24 months. In a couple of places, they will say, here's a form, and if your income goes over this threshold, you need to send in this form. Now imagine that everybody has to do that all the time, even if their income hasn't changed. Well, they're going to require it be at least every 6 months, and there's not like added money in order to administer this requirement. I guess they're just going to find it by all of the money they're going to save by disenrolling people from Medicaid. Here's the thing. The estimates say that somewhere between like 11.8 million and 16 million people will lose their health care because of the implementing of these requirements, which once again are not required to be implemented till the end of next year. So we've got a little bit of a rollout to this. But when has a long lead time ever made the government more efficient? In my experience, this has not improved government systems. What is going to probably end up happening, this is not back to the pre-ACA rates of people being like uninsured, which pre-ACA, it was 1 in 6 Americans did not have health insurance. It's not quite that high, but that's a huge number of people to not have health insurance. And it doesn't mean people stop having healthcare needs. What it ends up meaning is that people either don't seek care and they suffer the consequences. They die. I mean, that does happen. People do die because they don't have healthcare, so they'll put off seeking care. Their chronic conditions get exacerbated because they don't have access to healthcare. We've seen many stories of this from Arkansas and Georgia where people, like, the bureaucracy didn't work. Like, they kept trying to resubmit, like, hey, I do work a job, and their Medicaid got cut off anyway, and then they couldn't get the medications that they need. If they didn't get the medications because they lost healthcare, their conditions were not managed, and then they couldn't work. And in most cases, when the data is dove into, when researchers, I'm going to rephrase that. Let's use the active voice. Researchers dive into the data from states that have increased a work requirement bureaucracy and implemented able-bodied childless adult work requirements for Medicaid. Well, in those cases, they don't spend less money and people lose coverage. We have worse health outcomes. And in fact, we have seen reduction of employment in those states. And that's because it turns out when people don't have access to affordable health care, it can affect their ability to work and participate in society. So I think it's easy to gloss over the impact of Medicaid if you are not currently receiving it. And I've been on Medicaid before. I view it as a very, very essential part of the healthcare ecosystem. I just didn't have health insurance before the ACA was implemented. Like, I had it on and off at various different times. But I had long stretches of being uninsured before the ACA. And, getting on OHP was the reason I got treatment for my rheumatoid arthritis. It was the first time that I had like steady, reliable health insurance, and I had a way to, and I knew I wasn't going to get denied in the future for a pre-existing condition as well, which was part of it. So, it's easy to downplay Medicaid if you haven't had personal experience with it. And a lot of people have had negative experiences being on Medicaid as well because it has a lot of stigma associated with it. It can be hard to find providers sometimes in some places. But our healthcare system in the US is extremely dependent on Medicaid and Medicare dollars. You cannot put blinders on if you have commercial insurance and you are getting it through your employer or getting it through some non-government source and you're like, I'm not impacted by this, because the Medicaid cuts will knock out, like, I think the current estimates are like 300 to 400 rural hospitals are very likely to close once Medicaid has closed. I did a story when Medicaid gets cut. If we see mass disenrollments in Medicaid, which is likely to happen under this, I would love to believe that, we're all going to be great at bureaucracy and states are going to be wonderful at implementing this, but I haven't seen that prove out to be true in the past. Rural hospitals, a lot of times, like I was doing kind of pre-reporting on this on the early days of this administration in Oregon, and like Baker City, a city I'm going to next month in Eastern Oregon, a city of about 10,000 people. It's the next nearest like healthcare facility is 50 miles away, is like the next anything from Baker City. And it's on a stretch of highway that regularly closes in the winter because it's up a mountain. It's, like at elevation. And it regularly gets closed for snow and is isolated sometimes for days at a time, with the highway closed either below or above it to go to either Ontario and then Boise, Idaho, or to go up to LeGrand and then Pendleton. So Baker City has one hospital there, and that hospital, which is great. A lot of small cities like that don't even have a hospital anymore. That hospital has no OBGYN department. You can't have a kid in Baker City anymore. And 76% of their patients overall use Medicaid. And that's not just Oregon patients, because patients come from Idaho as well to go to that hospital. And that is also true of the Oregon and the Idaho residents. 76% of them are on Medicaid. There is a like sweetener that a lot of people are saying, oh, well, hospitals are going to be like rural hospitals. They need to stop raising these alarms about Medicaid because we have now capped this provider tax. So there is essentially Medicaid and Medicare are, let's focus on Medicaid. Medicaid is a state and federal partnership. So it'll be administered by the states, and most of the dollars come from the federal government. There are requirements that the state have a certain amount of federal match, and that amount kind of increased. It's when they expanded Medicaid under the ACA, they sort of ramped it down, and that's why so many more states chose to adopt having Medicaid. But it's about 2%, kind of give or take. There's different ways in which this factors in, comes from the state. So it's not that much. The way that a lot of states will end up paying for this is a thing called a provider tax. So they will tax hospitals, and usually it's about like 6% that they will tax to hospitals as a provider tax, but it really depends on the state. But those taxes that the providers pay will then be used as the state match against the federal Medicaid. And eventually that money kind of flows back to the hospitals because hospitals will get Medicaid money. Virtually all hospitals, except Medicaid and Medicare, it's such a large portion of overall healthcare dollars in this country. So the Medicaid dollars flow back to the hospital eventually. They, in this bill, capped the provider tax at 3.5%. That is not a sustainable rate for a lot of these states to meet their obligations to the federal government. So it's very likely that what we will see is states choosing to roll back who is eligible for Medicaid. So even if these work requirements do get implemented, essentially there isn't going to be enough money to meet the needs of Medicaid for a lot of states, and with these provider taxes capped. And you would think that like the Hospital Association, which is a big industry like lobbying group, would be like, yay, provider taxes capped. But instead they are freaking out about it because they're like, hey, we get that money back. If that tax gets capped, we're going to end up in this situation where we end up not having Medicaid available for people. Okay, so how does Medicaid affect you overall? Well, the cost of healthcare, even if you are getting commercial insurance and you're not using Medicaid at all, one of the ways that this impacts you, besides the fact that like you're just gonna know more people without healthcare, which obviously impacts your life, right? Like that sucks. But Medicaid in particular is absorbing a lot of the primary care and the routine chronic care visits that previously low-income people would try to seek out in hospitals. And that is like, we know this, that a lot of people would go to the ER for things that did not need to be ER visits, because that's where they like knew and were comfortable, and they knew there was charity care at these hospitals. And if you don't have health insurance, trying to get in at like the neighborhood doctor was unlikely if as like a cash pay patient, especially if you were not if you were at a Medicaid income level, right? So we had this initially when we had Medicaid expansion and a lot more people qualified for it. We had this like bump where people were initially seeking more care. We were seeing like higher rates. We were seeing just a lot more visits, and it was costing more than we like initially anticipated. But that leveled off. And what really happened, and we have this in the anecdata, but also the data, is that a lot of people were getting seen for chronic conditions, things they'd put off, for getting surgeries that they've known that they needed addressed, but they didn't have access to healthcare. So if people start going back to seeking in the ER or delaying medical care, it means that healthcare gets more expensive for everyone. We're going to see it pushed to the entire system. But I have another fun thing that's happening to healthcare that's in this bill. Well, it's an act now. It's signed into law, so I should stop calling it a bill. And this one impacts a lot more people. It impacts all of the people that get their healthcare through the marketplace, which could be early retirees, people that work for themselves, people that don't get access to healthcare through their employer, people for which their access to their health insurance at their employer is prohibitively expensive. They have access to buy on the marketplace. The federal government subsidizes those policies so that they are affordable. There was an enhanced premium credit that was implemented during the COVID era, where the federal government matched even more for people's premiums on when they were receiving these. And it's based on income. So if your income is over a certain amount, you don't receive any premium subsidy, but you're still able to purchase insurance on the marketplace. If you are median, and that kind of increased a little bit with these enhanced premium subsidies, your insurance was available through the marketplace, and you were getting quite a lot of subsidy per month. So maybe the health insurance cost, let's say $800 per month, like if an employer was going to buy it, and the premium subsidy would cap it at a certain percentage of your income overall. Let's say if you made like $50,000 a year, depending on the type of policy and your age and some other variables, maybe you're only paying 122 a month instead of 800 a month. And that subsidy will just come out every month. They have decided not to extend those premium subsidies, but they also put in place so premiums will rise next year. So those are set to expire at the end of this year. They didn't extend them in this bill, and it's all of the estimates that I've seen say that we expect premiums to rise about 75% if those don't go up. So people that might have gotten used to paying, let's say, $200 a month, they're now going to see that bill jump by 75%. For a lot of people, that's just not sustainable. Like, you can't absorb that kind of impact. So we're going to likely see a lot of people just decide to drop coverage. And we don't have the penalty anymore because the Supreme Court got rid of that. And they're not going to drop down onto Medicaid because it's going to get even more burdensome to stay on Medicaid. Additionally, they've done a couple other things in this bill to kind of make the marketplaces a little less efficient. The big thing is that, like, they have shortened open enrollment. So, like, open enrollment had been getting longer and longer. Now it's much shorter. This also happened during the Trump administration, pre-COVID, that they had kind of shortened the window for open enrollment, and like reduce the amount of navigators to help people like figure out which health insurance. So the open enrollment period is shorter. But then the other thing is that it used to be that you didn't have to reprove your income. So, like, if you stay on the same plan year to year on the marketplace, you could just be like, click, yes, I still make the same income. Now you're going to have to resubmit those documents every year, which likely is going to end up resulting in at least some people not carrying over their insurance year to year. The kind of last bit that is relevant, but I feel like is maybe like a little more difficult to understand. But if you lose your primary healthcare coverage, and let's say you get it through the employer, or maybe you were on a parent's insurance until you were 26 and you turn 26 and you need to find insurance, or you have a kid and you need to add a new beneficiary to your insurance policy, right? You need to add a new dependent. It used to be that while you were adding them on the marketplace, so like, let's say you needed to enroll in marketplace plan coverage, or you needed to add a dependent, like that's a lot of back and forth paperwork, right? And anybody who's like had a kid and then has to deal with adding it knows that like there's a lot going on and it's still like a lot of back and forth. So in the case of now, it used to be that you were eligible for those premium subsidies for up to 90 days while you worked out all of your insurance, like your enrollment paperwork. So if you had a new baby and you needed to, like, I don't know, get birth certificates, like sent to them, or you needed to get like income certification after you lost a job and you needed to like get your exit paperwork, and your statement of continuing coverage and everything from your last job, in order to enroll in the marketplace plan, you would still be able to access those premium subsidies on a monthly basis for up to 90 days. Now they are not doing that. And so they've shortened the timeline. So I think there's many areas in which we are likely going to see people drop off. Is this a return to the pre-ACA days? Not yet. There are a lot of indications that there is a death spiral going on, that like this could be the start of a slow unwinding of the ACA even more than has already happened, because, you know, they've been picking at it for years. So it is interesting to see. And then there's one last thing I want to talk about with healthcare that has really nothing to do with all this technical stuff about enrollment and the ACA and Medicaid. One very interesting thing, which is the cap on federal student loans. So, and there's also some stuff about PSLF, so public service loan forgiveness. So we have a provider shortage in this country, and we especially have a provider shortage in the lower paid medical fields. So, primary care, rural healthcare, infectious disease are a great example of specialties that do not pay the big bucks like, um, dermatology or, um, surgeon in a big hospital. I don't know. Those are let's focus on these three ones: rural, um, general practice, and infectious disease. We desperately need people in these categories. So, one of the things that they did in this bill, which does affect a lot of people, is that they capped how much you can borrow for professional and medical school in federal student loans. So you used to be able to have access to what are called Graduate Plus loans, and you would have access to those after you had tapped out your subsidized and your unsubsidized Stafford loans. Now they're capping it at $200,000 for professional and medical graduate school. So in the case of certain people, that is not going to affect them. They don't take out $200,000 because they have access to other family resources. For most people that are entering medical school in the year of 2025, they will be taking out more than $200,000 in student loans. And that's because the price of med school is wild. They also have changed the ways that you can limit your repayment, essentially. So what is going to end up happening now is, because there's less flexible repayment terms, because they undid all of the kind of interesting things that Biden did with student loan repayment, it means that now you're going to have providers that are graduating and are going, yeah, I cannot afford on a primary doctor salary. Very interesting cat situation is going on here. I don't think it's going to work out for you, kitten. She's trying to approach the wheel from above it, which is interesting. Oh, Machka. We're just gonna this is likely to continue the spiral. I love the idea of saying no more than $200,000 of federal student loans for medical school when their idea works, which their idea was to force medical professional graduate schools to lower their costs, with the idea that you don't have these like freely flowing federally subsidized student loans hanging out. But what is realistically going to happen is these institutions are not going to lower their costs, and instead are just going to decide that students need to take out private predatory student loans, which means that they're going to have even worse repayment terms after they finish residency, and they're going to have to go into the highest paying specialties instead of the specialties that we desperately need, because they aren't going to be able to afford to repay those private student loans. So, yeah. Does everybody feel optimistic now? Giovanni says, I've paid $0 for my graduate work. Thank you, NIH. Well, we weren't going to have that much longer, so. Minnie, lovely to see you. I'm sorry that I didn't see you in the chat. I was off on a race. But I do think I do think that, like, there are a lot of things that are similar in Canada. NYU's med school is free, I believe. I don't believe that. No way. To all, NYU Grossman School of Medicine offers full tuition scholarships to all enrolled students, regardless of merit or financial aid. So but they do still need to borrow for cost of attendance, because you can't have a job outside of it. So you have to pay for living expenses in New York City. So $35,000 a year. is their estimate after the tuition scholarship at NYU. I'm looking at NYU's website. So that means your total for the 3 years of med school would be 35 plus 37 plus 37. They have a really nice chart on their website, so I'm just going off theirs. So theoretically, it would be 109,000, but that would mean that you'd have to have less than 80,000 in student loans from undergrad, which is doable, is possible. Yeah. So it's tight. It'd be like 150,000 in living expenses. Or you have a spouse that is paying all your living expenses, which I think is how a lot of people end up doing it. Okay, there's so many updates here. David says I wasn't optimistic before. Well, I really would agree with that. AS, I do agree that overseas med schools will see a bump. I think a lot of people are going to be going to schools of medicine in various Virgin Islands. Winter says I'm dropping in for the end. Well, actually, we've been going really hard. I haven't even eaten the donut yet. Okay, y'all, do you think I should put the donut in the donut log this week? Because I've had it multiple times. So it's in the donut log several other times. So I feel like maybe I shouldn't put it in the donut log. Let's see what last time I rated the... Let's see what my last rating is. This one really does not want to stay. I had a cinnamon roll last on 5/27, so it's been only like 6 weeks, and I rated it 4 out of 5. But then I had it again before that. I feel like I should stop putting the same donut in the donut log. Yeah, okay, but it's been a while since then. What do we think? What's the vote? Med students do have high divorce rates, but often they do have a spouse that's supporting them while they're in. Did I add pages to the donut log? Well, actually, I've got just one page left, but Aaron, for my birthday, got me 2 more donut log books. So I have excellent gift, really needed. So now I have additional ones. A cinnamon roll is a donut like a hot dog is a taco. I feel like a cinnamon roll being a donut is like the least controversial donut that we've had. K-Walk Comedy, I'm on the board of my local rural hospital. I hope we survive this bill as we are all one hospital serving the underserved in our community. They were supposed to get like this increase in the assistance program for rural hospitals, and they did not get the pump up that they wanted. But that's so cool. Also, every time you mention something you do, K-Walk Comedy, I'm like, how many things do you do? I am not worried about you being bored in your retirement. I have to say that. K-Walk Comedy says, I'll be old, but not without access to Medicaid. Well, you'll have Medicare, theoretically, hopefully. They really didn't gut it as much. I just don't know if we're going to have, like, a healthcare system. Okay, let's see if the rating is different. Can I organize a bike move for you, by the way? I can help you organize a bike move, but I don't know the local crew around you. Here, like, I know where all the places to advertise. But I have a friend who wrote a book called How to Bike Move. So, all right, we should really eat a donut. AS says, I hear university is free in Norway, even for international students. I think the only problem is that you then Like if you were to go for something like med school, you would then need to like still take your boards in the US, right? All right, here's our cinnamon roll. We are going to see if it has a different rating than the last time. Then I'll put it in the donut log. That's our verdict here. Oh my gosh, it's also so sticky. David, we just walk them up the stairs. We park the bikes down on the sidewalk, and then we carry stuff upstairs. Winter says, I did a year of veterinary school in the Caribbean. I didn't finish due to an illness, and it was an experience. Yeah, I have a coworker whose wife is a veterinarian and did it. And I think you need to heat this up if you want to take a donut tax. You actually don't get a donut tax because I now have a $12,500 deduction on overtime. David, it does seem a bit redundant. I don't think you have a bike move. I think you just need friends. I'm helping a friend do a non-bike move, hopefully later this month. Thank you for the heated. Do you have windows in a line? Could you try to create a contraption to move everything up and down between the two apartments? I mean, I'm not critiquing your hermitdom because I understand. But there's times when the peace and quiet can backlash on you, and that's when you need to convince people to come help you move. Winter, I have long considered taking my EU citizenship and running away to go to grad school, because in Germany, school is also free. And I'm an EU citizen. Although some places do it by EU residency, not by citizenship. And I'm not an EU resident. So I would have to just then go live in Croatia for a year, become an EU resident, and then go to grad school, which doesn't sound like the worst. If I get laid off from a career in journalism, which feels like at a moment, at any point. David, you can also just pay someone to move things for you. It's pretty cool. You live in the place where it is the easiest place to possibly pay for someone to move things. Did you take your tax already? Okay. The tax is already gone. This is good. I don't know if it's a 4 out of 5 this week. But maybe it's because my expectation for the cinnamon rolls are sky high. Winter says the Netherlands is also free. My friend is going to go back to school in a couple years. Croatia will pay me some amount of money to move back there. It's not a crazy amount of money. It's like $2,000 or $3,000 if you move from outside the EU back to Croatia. And like slightly more if you move to somewhere like other than Zagreb or Split, like in a less populated area. And I was like, I could do that. I would not want to take actual. I was just chatting with someone at Coffee Outside that actually went to do med school in Croatia. Actually, I totally forgot about this. I think the downside for me is that my fantasy, like, if cost and time were no barrier, I would want to go to law school. The problem with law school is that I don't want to be a practicing lawyer. I just want to go to law school. That sounds fun. In like a very particular me way. The issue is that law school in Europe will not teach me about US law. David, if it was so easy to find people to do something, I would hire someone to clean my bathroom. You can absolutely do that. This is possibly one of the most hired out household tasks. This is a money can solve this problem for you. AS, I want to know about what obscure rule you're trying to get British citizenship under. All right, does anybody else have any other questions about money things in the bill? Honestly, we could do like 5 hours on this bill. And I haven't read all of it. I've been like pulling from the text, and then I've been trying to look at like other analysis for some of this. And I've been trying to get analysis from news outlets that are lean one way or the other, so that I've got an interesting perspective. I'm really curious. So I don't know if people have heard of the Laffer curve, but the Laffer curve was developed by one of Reagan's economic advisors, comes from the Saltwater School of Economics, Professor Laffer. And the Laffer curve is essentially a bell curve about what the optimal rate of taxation, like of the highest marginal tax rate, is to stimulate economic growth without tamping it down. So the idea being that, like, if your highest marginal tax rate is 90%, the Laffer curve says that probably is high enough that people are less likely to invest. You get less economic activity because the tax rate is so high, and people are like, captains of industry, as you might say, are like not motivated to earn money if 90% of every dollar is. When we have had that as a very high tax rate, so like in the 1950s and 1960s, we had like very, very high tax rates for the highest income earners in the 90% era. But that wasn't the effective tax rate because of all of the other ways in which, as we discussed at length, the complexity of our tax code brings it down from 90%. Very few people were actually paying 90% of the topest dollar of everything they earned. But the Laffer curve says there is some amount between 0 and 100% that is the perfect top level of taxation for generating enough revenue for the government, which is the point of taxes after all, but without slowing down economic growth. Because if you slow down economic growth, then eventually the government gets less money. Now, Laffer, as you might be able to tell for working for Reagan, he's like very much held up as an economist in the school of like what we were calling in the 90s and early 2000s the trickle down economics, right? This idea that like if you are benefiting the richest people, eventually it kind of reaches down below. There's some credence to that theory, and some of that parses out in the data, and then some of it is a little exaggerated, just like everything, right? Like the truth is somewhere in between. Is it likely that this bill is going to substantially boost economic development and growth? unlikely because we've now gotten used to these conditions. It's mostly extending conditions from a, bombacious 2017 tax bill. Will some people perceive themselves to be in a better financial position because of these limited time for the rest of Trump's term, these limited time boosts to, deductions via the no tax on tips and the no tax on overtime? Probably. However, healthcare overall is a very large portion of our economy, and healthcare has people's access to healthcare has a really large impact on development. It has a really large impact on economic opportunity. And if people can access jobs and working, and I think it's very likely that the consequences that we see over the next 2 years from healthcare, we really start to see the effects in 2027 as we've got kind of the winding down of the no tax on tips and no tax on overtime thing. But I can't see into the future. And really no economist can either. Even the Laffer curve is just something he drew on the back of a napkin and is now taught in macroeconomics classes forever. David, you can find someone to bring their own hazmat suit. I'm just telling you, this is all a doable, hireable out thing. If you really want to, you can. Do you need us to help research cleaners for you in New York that will do high, what's the word we're looking for? I don't want to say high problem cleans. Difficult cleaning, deep cleaning. Giovanni says law school is great education for the mind. I would love to do law school, but once again, I don't want to be a lawyer. I mean, I would want to be a lawyer if the field of law was not very broken. I think every field is broken if you really dive into it, but it seems like it is punishing for the sake of punishing, and often in a lot of types of law that you have to do to pay off your law school debt, because law school is so expensive here, types of law you end up doing, you're really not working for the good guys. And that's just like universally true, because you're mostly working, if you go into big law in order to pay off your law school debt. At that level, none of them are really the good guys. Okay, my family is West Indian from a former British colony. I can get citizenship through descent because my parents were born when the country was still a colony. Oh yeah, that makes sense as a loophole. I know like quite a few people that have, what is that? Where did it come from? Is it for me? Came from Georgia and it's for me. Oh, I see what it is. I see what it is. Aaron's ripping off the sticker, but I wasn't going to show our address on the screen, and now I don't know who it's from. A package just arrived, and I do not know what's in it, so we're going to find out. Live unboxing. It smells very chemically. Is it Amazon Prime? Oh, it's shoes. I forgot. Y'all. If you can hear this over the crumbling, I got jelly shoes like you have in the 90s. They now make them in adult sizes, and they do smell chemically because they actually smell like bubblegum, all these shoes. This is the brand, I think they're from Argentina or maybe Brazil. Argentina or Brazil, I can't remember which one. But this was all the rage among like 9-year-olds in the 90s. Anyway, they have them in adult size now, and I've been curious about them, and they were on sale, so. I think you should hire crime scene cleaners for your apartment. I think that's a great idea. Giovanni says, I know plenty of people who went to law school but do not practice. Same, but a lot of them either are independently wealthy and come from money, or they are drowning in law school debt. So I'm not particularly interested in that. No, this was not for the MySpace ride. This is not really the right era for the MySpace ride. No, this is actually just because I wanted some closed-toed shoes. Well, we'll see. I don't know if they're very comfortable though, but I don't know if they might be a little too tight in the front. It's very hard for me to find shoes because my feet are such a weird shape. Aaron says they are so smelly. I think it's because they've been sitting in the heat, because they're still warm on my feet because they're made of this jelly material. Oh yes, I wanted everybody to admire these. My neighbor is a metal worker, and she made me these amazing cat earrings for my birthday. And because I am also a crazy cat lady, as she said. But look, they even have like little whiskers on it. They're very cute. I'm very happy with them. Yes, I agree with this. To get the most out of your money, you should commit a crime in your apartment. Oh my God, jellies, they will eat your feet. Well, that's the thing, is apparently so I didn't know that these like re-existed, and then I saw these fantastic shoes on one of the volunteers at a event I was doing, and I was like, oh my gosh, those shoes are amazing. And she's like, oh, they're Melissa, like the jelly shoes from the 90s, but they make them in adult things. And I was like, oh, they must be terrible for your feet. Like, because, you know, they would like attack your feet and you would end up with all these weird welts on them. No, apparently they're really nice and very comfortable. They're like an eco shoe brand too. Like everything's made from recycled materials. I mean, I think it's always kind of a little bit of greenwashing, but I know someone that has, from, not St. Martin's. What's the UK one? St. Martin's is, oh wait, isn't there a UK St. Martin's and then a Dutch St. Martin's? Anyway, from one of those islands, and got their British citizenship and has lived there for like 10, 15 years. Okay. What do we think? Should I continue to have jelly shoes? Also, these are closed-toed. I don't work in an environment where it requires closed-toed shoes, but I did for so long that I still feel like I have OSHA requirements to do closed-toed shoes. Do we think these are appropriate Pacific Northwest newsroom office wear? I feel like they are in the summer. They are really smelly, though. They smell like bubblegum. They come in lots of different colors. They come in platforms too, but I didn't need... Platforms is not what I was attempting to figure out. Winter says they go with your top. Well, this is also a very sparkly floofy dress. So, this is from a Utah Mormon-run brand of floofy, sparkly dresses, Jessa K. Their stuff is not the highest quality, but very, very fluffy. So I usually only try to get it, and it's produced in China. So I try to only get it secondhand, which is just generally my rule for most clothing, is I try to get stuff secondhand unless it's ethically made. But Fuzz Bubbles, as someone who works at a lab, those may be closed-toed, but they are still open shoes. Yeah, I wouldn't say that these would be legal for a bike shop, I think. I mean, I definitely could get away with wearing them in a bike shop, but no, I would not wear these in a lab. But that was the goal, open shoes, because I don't own many open shoes, because sandals are, I don't like them. Also, no one needs to see my toes. Like, it's just, the only place anybody sees them is when I'm doing yoga. And my stance is that anybody who's looking at my bare feet in yoga is not concentrating on yoga, and they probably should be. So the US just still has some of their colonies. St. Thomas or St. Kitts? Okay, let's find out. Because isn't there a Saint? Is it just the English versus the? Okay, Saint Martin is the Netherlands. And then Saint Martin is, yeah, okay, I am correct. But I was wrong about which country. Okay, so Sint Maarten, I don't know how to say it in Dutch. Let's say that that's right. I probably need to swallow more of that for it to be Dutch. Sint Maarten is the Dutch side, and then Saint Martin is the French side. And it's the same island. It's like Haiti versus Dominican Republic. I was quizzing my niece on U.S. territories, and she didn't know about Puerto Rico, much less the Northern Mariana Islands. I mean, there's an awful lot of islands that are still territories. Marshall Islands are the most egregious of them. Yeah, I mean, the Marshall Islands, now everybody can get, everyone in the Marshall Islands is allowed to get citizenship in the U.S., I believe. I would wonder if it, I kind of want to, now, okay, y'all, I can't get into this research right now. This is not what we're talking about. Oh, David said not Marina. Yeah. Did I? This is one of those things where I always just read it internally. And so I just apparently abbreviate it Mariana Islands. What is Midway Atoll? Are we just naming islands now that are U.S. territories? Is the Midway Atoll near, is it near the Marshall Islands? Oh, it's part of the Hawaiian archipelago. Interesting. Okay, y'all, this is not island talk. This is not talking dough and talking about islands, because I don't know that much about islands. Is Midway Atoll the same as Bikini Island? I thought that was a different atoll. Am I wrong? Oh my god. Turns out I don't know very much about islands, is what I'm really learning. I want to meet someone who made it their project to visit all U.S. territories. That actually sounds like a great one. I'm sure there's a Guinness World Record for like fastest time to travel to all of them. I'm contemplating right now. My birthday was making me contemplate what big next travel project I want to do. And I am thinking I am going to retry for in 2 years, because then I'll have enough vacation time for it. The attempt at the Guinness World Record to set the Guinness World Record for the fastest travel time to all EU capital cities by scheduled surface transportation. So I'd done a bunch of research on it and had a bunch of spreadsheets, and I'd found a fastest path. But now there is a ferry that operates from the Greek side of the Greek side of the island, so I don't have to go through Turkey anymore. So anyway, I think there might be a faster way to do it, so I need to recalculate it out. But last time I looked at it, it would take 28 days to do it all. So the Guinness World Record mechanism for saying doing something by public transportation is scheduled surface transportation. And you can't use planes for that category. So I have to redo it, but I think I might be able to get it down to 27 or 26 days. There's no current record for it, so I'd be setting it, not trying to beat it. But I thought that would be kind of fun to do in 2 years from now. I was also trying to figure out if there's like a Balkan specific one I could try to do that's like going to all of the former capital cities of former Yugoslavia or something like by scheduled surface transportation. That could be kind of fun. I don't know. But that's my current project. David says no rush if we're in island time. Okay, I was correct. I thought Bikini Atoll and Midway Atoll were different because Midway Atoll still exists, right? Fuzz Bubbles. No, you do not have to have someone from Guinness come witness it. You just have to submit data. So a lot of the people use GPS trackers and then like receipts and stuff like that. It usually does take a long time to get everything kind of together, but I was thinking about starting a podcast about my move called Apartment Files NYC. It will be like when an Eastern European country rips off a US sitcom. I'm on board. I'm so on board with the Apartment Files. By the way, I think you will be happy to know that we have 2 House Files episodes on their way, and a new one just got uploaded this weekend. So if you have been eager for a House Files episode, it is a bit of an old one because it was filmed, I think, back in February, but is the start in Helsinki? No, I think I can share this. I ran through a bunch of different scenarios, but no, Helsinki's quite fast, so I don't need to do that. Okay. Okay. Europe. Okay. Lithuania is one of the starts. Denmark is one of the starts. I think Dublin or Portugal were the best 2 options. And I tried 2 different routes. I tried like Portugal to the Balkans to Turkey. The big problems are the islands. So Malta and Cyprus are the 2 issues because it's just EU capital cities. If you do European capital cities, you have to go to Iceland and Russia, which is a little more complicated right now. And so I think the fastest route that I found is the Dublin start. So it's Dublin, Holyhead, London, Euston, Brussels, Luxembourg, Thionville, Paris, Amsterdam, Berlin, Hamburg, Padberg, Copenhagen, Malmo, Stockholm, Turku, Helsinki, Tallinn, Riga, Vilnius, Warsaw, Prague, Bratislava, Vienna, Budapest, Bucharest, Sofia, Plovdiv, Svinlingrad, Istanbul, Tasaku. This is where I can get faster because I no longer have to go through Turkey to get to Cyprus if the ferry stays up that goes from Greece to Cyprus, to Greek Cyprus. So Krenia, Nicosia, Tasaku, Bodrum, Kos, Perinas, Athens, Thessalonica, Skopje, Belgrade, Zagreb, Ljubljana, Trieste, Rome, Ispica, Pozzallo, Valida, Pozzallo. I had to go back. because I have to get to Malta by the ferry. Syracuse, Catena, Naples, Torino, Chambry, Valence, Barcelona, Madrid, Salamanca, Lisbon. That is the but and that route would take 20 days. So actually I had gotten it all the way down to 20. I can share this spreadsheet if anybody wants to see it. I have to redo it, so I'm not worried about someone stealing it. If I do a House Files knockoff, I need to cast some hosts, though. Is it a New York equivalent of the 2 hosts of the House Files? I think the person you hire to help you move is also a House Files host. Your great uncle Mike, in the Army Signal Corps after the invasion of Italy, tried to grab a boat and sail from the eastern coast of Italy to Kirk and then Yugoslavia until his first sergeant found out. I love that this could be or could not be true, but I like it as a family myth. B said, I watched that and then I wanted to disappear into the void that was your sound booth. Someone asked, like, why it was painted black, and I don't think I remember why. Like, do you remember? I don't remember why, but I kind of love it. I love that it's just a void that you go into. I want to know what antennas Aaron is installing. You have to do an antenna episode, Aaron. Okay. This sounds like my last game of Ticket to Ride. Yeah, I kind of accurate. A little more fairies, though. But I guess you can build fairies in Ticket to Ride Europe, can't you? Apparently, my great uncle had to get lectured on the technical definition of desertion, even though he just planned to stop in and check in on his cousins. All right, y'all. I don't have a meeting after this, but I probably should let you go at some point. We all gotta like go to work, do things. I expect to hear that you've hired someone to clean your bathroom next week, David. You can hire someone to clean your bathroom in the next week. I believe in you. I think this is possible and you should do it. And even better if they are your Apartment Files co-host. Now, please, everyone, tell me what you're looking forward to this week. David is obviously looking forward to hiring someone to clean the bathroom, but what am I looking forward to this week? Oh, actually, I think the thing I'm looking forward to is a little silly, but should be fun. I am taking a adult bike bus tomorrow. So the bike bus is like where kids will ride to school together, and like it will pick kids up along the route and take them to school, and it makes it a little like safer for everybody to bike to school because there's like a critical mass and there's like adults with them. So there's like a ton of bike buses at elementary schools and middle schools in Portland, but the city has gotten in their head that they want to do like a grown-up workplace commute bike bus. And so, which is, I think, like fundamentally flawed because not everybody needs to go to work at the same time or even in the same part of town. But it's presuming this like downtown like locus of where everyone is going, which is also very funny because I know almost no one that works downtown at this point anymore. But they've got like 5 nodules going from all different quadrants of our city. They are called quadrants, even though we have 5 and kind of technically 6. It's confusing, but we call them quadrants. Anyway, all the different like Portland equivalent of boroughs of the city, and they're like merging in and they're all meeting in at this like downtown landmark tomorrow morning at like 8:15 or something like that. And then it's another like 3 miles to my office from there, but I am going to ride it because there is a route that goes extremely close to my house. So it sounds fun to try it once. They're only doing them like once a month. I normally would not go into work that late on a Wednesday, but I'm not on air, so it's fine. And it's my birthday week, so I can do it if I want. Do I live near where the show Grimm was filmed? I think it was filmed all over Portland. It was filmed, part of it was filmed in Aaron's old co-working space. But I don't really, I've never watched it, so I've seen locations, I've seen various places around town closed for filming all the time. Isn't a lot of it take place in Forest Park? A year of Les Mis starts on Bastille Day. Okay, that does sound kind of fun. You're doing JFK to FRA to SOF on something called Premium Economy Basic. That sounds awful. I'm so sorry. But I am excited about you going to Bulgaria. That sounds fun. Fuzzbubble says, looking forward to more ankle PT. I'm excited for you looking forward to ankle PT. I want you to have more ankle mobility, but I find it astonishing that that's what you're looking forward to. Did you have any ankle accomplishments this week? I'm very curious. I've been doing a bunch of meal prep for my parents. Meal prep can have like a nice vibe to it. And it's also like a calm way to do care for other people. So I feel like that is to your benefit. Well, I hope that they both recover very well and keep yourself sane. A luxury week at the Sophia Apart Hotel while I teach a class on teletype reject handling before coming back and collapsing back into hopefully my new not old bed. Well, that's exciting. I think while you're in Sophia, you should have someone come in and clean your house. I think it's a great idea. Oh my god, your boss sent you to Manila standby? That's wild. I guess if you're non-rev, were you flying on your own employer's airline? I went out without the boot this weekend for the first time, but then I walked too much and it was super swollen. I mean, I think this is a lesson we all eventually learn when we injure ourselves and we're recovering. But I'm happy you went out without the boot. I hope that your ability to walk around increases as you do more PT. Yes, your company better pay you back the money for the ticket. The idea of sending someone on an international work trip standby is bananas to me. Also all the way to the Philippines? Lord almighty. Okay, $60 round trip is a bit of an accomplishment, but I feel like that should be your own accomplishment. Not you sending your subordinate somewhere to do something. I feel like if you want to brag about how you got $60 round trip to Manila, then you need to be flying it. You need to not be sending your employees standby. Good. Well, I'm glad that your current boss thinks that's bananas. All right, y'all. We don't have a floof this week. I'm sorry. If you submit me one, questions@ohmydollar.com, or on the forums, anywhere in the forums. Wait, hold on. Where's my forums? There's my forum overdue. So if you go to the forums, you can submit a floof of the week. Do I have my other floofs? Oh, they are napping. Could I get a floof of the week? Here, we'll do a floof of the week. That's just my floof in my house. Is it up? I don't see it. Oh, it's on the cat cam. No, that's not the cat cam. Where's the cat cam? She's being very cute. There we go. There she is. Look at that cutie. Look at her. Aww, she's a pretty good floof. I rate her 9 out of 10 right now because that last 1 out of 10 is when she learns to use the wheel. This is quality content. All right. Is she giving side-eye? No. She's just making air muffins. Look at the baby. Okay. All right. You've done your job. Amusing everyone. Good job. Aaron's hand's probably tired. Having to hold a camera with one hand and pet a cat's belly with the other. All right. Well, thank you all for joining. I hope I didn't depress you too much. And until next week, stay safe, stay hydrated, pet a cat if you have one available, and I will see you all soon. Bye.